In tonight's Health Watch, clearing up the confusion, misinformation, and myths about the coronavirus.
How long does the virus live on surfaces? And are children immune? And is it as deadly as some people say? CBS 2's Dr. Max Gomez here in studio with some facts for us.
That's right. And here's the problem. The coronavirus is a brand new germ. And so we're still learning about it literally on a daily basis. But when there's a lack of information, myths and rumors fill the void. So here's the real deal, beginning with the best way to prevent infecting yourself. One of the best ways to not get infected is to not touch your face. Here's why.
We know that this virus can get onto different surfaces, and if you touch those surfaces and it has the virus on it, you can get that virus on your hands and actually spread it to yourself by touching your nose, your eyes, or your mouth.
But Dr. Vanessa Rabe, infectious disease specialist at NYU Langone Health, acknowledges that not touching your face is really hard. Some studies say we touch our faces an average of 1,000 or 2,000 times a day. And you don't have to search very hard on the internet to find people talking about how hard it is to avoid touching your face. Okay, let's talk about some corona myths. The family pet can carry the virus. False.
We don't have good evidence right now that cats or dogs can be affected. Generally, once a virus is adapted to be in one species, it doesn't transmit to others very frequently.
Children are immune to the coronavirus. False again.
We know kids actually can be infected with this virus, just like adults can, but they tend to not get as sick as adults.
The virus can survive for a few days on surfaces. That's probably true, but it depends on the surface, the temperature, the moisture. But the good news is that corona can easily be killed with household disinfectants. And perhaps the scariest myth of all is if you get the virus, you will probably die. Absolutely false.
80% of people who get coronavirus have mild to moderate disease, probably similar to a cold or a mild flu, and some people can get this virus and not have any symptoms at all.
Now, the actual death rate is now settled in at around 1%. That's somewhat worse than the flu, but nowhere near as bad as SARS, MERS, Ebola, and other emerging diseases. Now, you may have heard of the 6-foot rule to avoid getting infected. And that's because the way a person spreads a virus is by coughing or sneezing virus-laden particles out in the air. Those droplets are fairly heavy, and they fall to the ground in about 6 feet. So if you're around a cougher or a sneezer, keep that 6-foot social distance away from them and don't shake their hand.
Don't shake anybody's hand right about
That's right.
now.
You know, just a bump or something.
Exactly, right? To the people who say, you know, washing my hands and keeping my hands off my face doesn't feel like enough, what do you say to them?
That's all we got.
Yeah.
I mean, actually, that really does help. It really does help. Keeping away, this is a big way to infect yourself, and washing your hands. That's the best way to do it.
The only way, right?
So far, yeah.
And keeping a 6-foot circumference around everyone.
Everybody stand back.
Stand 6-foot bad.
All right. 6 feet.
There you go.
Thank you, Dr. Max.
Learned it on CBS 2.
You heard it.
Thank you.